For me, when I become a doctor, I told you before, I choose the patient. I will do everything the patient needs. Right now, the patient is online. In Uganda, at the first time in my life, I recognize we can treat for the patient with limited resources. Sometimes we just said, oh, I cannot do this for my patient because we don't have enough equipment, we don't have enough money, But in Uganda, where the country is less developed than Vietnam, but they can take care of the patient better. So I was very impressed. So I think, wow, they can do it. So why we cannot do that? And after I coming back from Uganda, I decided to taking care of the hydrocephalus patient in Vietnam.
Hello and welcome to the Demystifying Healthcare in Vietnam podcast. I'm Beth Ann Lopez, founder and CEO of Docosan. We're on a mission to make getting healthcare effortless and bring you insights from Vietnam's top players in healthcare. On this week's episode, we're speaking with Dr. Quang My, who is a pediatric neurosurgeon practicing at the Nha Trang Hai Hospital in Ho Chi Minh City. He's also the founder of Big Head Baby Clinic, which specializes in treating and supporting children born with hydrocephalus. So he's got a very impressive academic background and clinical achievements. After finishing medical school at the University of Medicine and Pharmacy of Ho Chi Minh City, he completed his surgical fellowship focusing on the treatment of hydrocephalus patients in Uganda at the Cure Uganda Children's Hospital. He also completed fellowships in neurosurgery at Tulane University's world-renowned Ochsner Center and at the University of Alabama School of Medicine. So not only does he provide a fascinating perspective as a highly trained clinician, but he's been able to experience working as a surgeon in different healthcare systems across the globe. So Dr. My, it's an absolute pleasure to be with you here today. And so we're going to talk about pediatrics in Vietnam, a subject you know probably better than anyone here. So you spent your career dedicated to treating patients with hydrocephalus. And getting started, what is hydrocephalus?
Yeah, so firstly, hello everyone, and thank you, Beth, and thank you, Docosan team, for invitation. So hydrocephalus is a medical condition in which build up a lot of fluid inside the brain. And for a long time, it can increase the pressure inside your head and potential to damage the brain tissue.
Wow. And how common of an issue is this?
Hydrocephalus is, if we have 100,000 new baby, we have around 10 baby with hydrocephalus.
I see. Yeah. And why is this issue so important to you?
The first, hydrocephalus is treatable disease. It means if you had the children with hydrocephalus, if you have diagnosis very early, you get the good treatment and also have very good following up. That baby can have very normal life. I mean, that children can go to school, can go to work, and can get married. Somewhere, some people think, oh, hydrocephalus is very terrible, and the patient cannot live, cannot have a normal life, or sometimes cannot survive, So I think we need to do something to change the community thinking about that disease.
Oh, wow, absolutely. So you can completely change their lives if you catch it early.
I hope.
Yeah, wow. So Dr. My, what is the Big Head Baby Clinic and community?
So my clinic, we can call that as a Big Head Clinic Baby. That is a part of my project for the hydrocephalus patient. So after doing the fan page for hydrocephalus patient in Vietnam, I think I need a place where I can freedom to do everything for the patient. The patient can come to see me. We can have very long conversation. I can see to chat the patient and do everything, even taking the video or something for the fan page. And also that is my startup in healthcare business. But I think I learned a lot from them.
Yeah, no, that's amazing. So you're meeting the patients where they are online and engaging with them through video and other educational means. That's great. And why is this an unmet need in Vietnam?
So when we decide to become a doctor, especially in Vietnam, so I think our customer is the patient, So I will do everything for the patient. And it means where the patient is, where I am, So what the patient needs, I will do everything for them. So in Vietnam, the patient is not only needed the treatment, but also need the advice, sharing, following up, everything. And so I try to figure out the way to go together with the patient for a very long time.
Oh, wonderful.
Yeah.
And so how do patients usually find out that their children have hydrocephalus? What is that treatment journey like?
Yeah, in the past, we can see many patients with very big head because the patient don't know about hydrocephalus disease. So when we see the patient with very big head, it means it's very late. It happened for a very long time. So the lacking of information. So I recognize that after coming back from US in 2019, because at that time in US they did everything for the patient. A lot of social media, like the video, like a website for the patient. And I think, I should come back and look up on the Google about hydrocephalus. Nothing, So I think, we don't have anything for the patient after discharge from the hospital. So I need to do something. But at that time I'm still a small guy. Now still a small guy. So it's very difficult for me to do something bigger, like go on to the TV, television, or something like that. And I just think about an option, and I decided to do the fan page because it's free, And at that time, in Vietnam, we have, I remember there's more than 100 million users. Facebook user. So it's free and it's very easy to connect with the patient. And I decided to do the fan page for the patient at that time.
Yeah, I see. Digital adoption is so high in Vietnam. Everyone is on their phones looking at Facebook, TikTok, all of that kind of stuff. So it's very interesting to see doctors also now getting involved in that too.
Yeah.
But you had mentioned that you had seen what it was like for surgical treatment in the U.S.
Yeah.
And so you studied at University of Alabama School of Medicine, did a fellowship at the Ochsner Center. What did you learn there? And what did you take back to Vietnam from that experience?
Yeah. Thank you for your question. U.S. When Vietnamese or the other people talking about U.S., they just talk. That is dreamland, right? Because everything is perfect at a very high level. Yeah.
I mean, as an American, it's not quite true.
So I think after I coming back from Uganda, and I think U.S. is a very perfect system in the healthcare. And it's not only for me to learn about the knowledge in pediatric neurosurgery, but also about the system, how to manage a patient from the community to the hospital, and after that, give them back from the community. I think they do many things, and they have very good model to do that.
What in particular stood out to you as a good model?
I think we need to create like a bridge for the patient, easy to get into the medical staff everywhere, everywhere, and sometimes it's anytime. But U.S. model is the cost is very high. Yeah. That's the problem. So when I coming back from U.S. I think we need to do something to shorten the gap between the medical staff and the patient, but it will be cheaper. So I decided to do the social media platform.
Okay, I see. And so I guess like for the patients in Vietnam, what is it usually like in getting pediatric care? Like how do they know where to go? How do they even find you?
Yeah. In Vietnam, we also have many medical staff in the village, but in the very far away from the city, the doctor or medical staff, they treat depend on their experience. Is that the personal experience? It's not a science,
Oh,
so It's very easy for them to go to see the medical staff, maybe the doctor, or sometimes they can go to pharmacy to get the medication. And now we can see so many people, they are using the media, social media platform like Facebook, like Yellow, and sometimes YouTube. And they also get the information from there.
Is there a problem with any misinformation on those kind of channels?
Yes, we have a lot of information on that, but the problem is where is the good information and where is not good information. I think it's only 20% is good information and 80% is not good. Because many specialists, they don't have time and they think they don't have skill to do the social media. If you want to do that job, you need a little skill. But at some point, they don't have time and they are not really not confident to do that. And finally, the patient healthcare information.
Yeah, that's something that I noticed in Vietnam too, is a lot of doctors and highly trained medical staff are hesitant to use kind of new technology or be on social media. They think that they can't do it. And so then you have all these other voices who, I guess they're just like influencers, but they don't have the knowledge, but they're reaching so many more people. Yeah. So I think it's amazing and really needed that people like you with that high level of education are meeting patients where they are. Yeah. I think this will be the future. Yeah. And so you'd mentioned doing your fellowship at the CARE Uganda hospital. And so what was it like working in Uganda, and how was that different from Vietnam? What could you bring back here?
Yeah, so I think I learned a lot from Uganda, and I also love Uganda so much. That is the first time I traveled outside Vietnam for a very long time. I stayed there in 2 months. And in Uganda, at the first time in my life, I recognize we can treat for the patient with limited resources. Sometimes we just said, oh, I cannot do this for my patient because we don't have enough equipment, we don't have enough money, But in Uganda, where the country is less developed than Vietnam, but they can take care of the patient better. Wow. Yeah, so I was very impressed, So I think, wow, they can do it. So why we cannot do that? And after I coming back from Uganda, I decided to taking care for the hydrocephalus patient in Vietnam. I started to work from very small thing,
Yeah. Was there a particular case that stood out to you that really solidified why you wanted to work with hydrocephalus patients?
So in Vietnam, in Uganda in 2016, the smartphone is not common. Most people just use very traditional phone. They cannot access to Facebook. The phone just used for calling and texting. Most of patients, they live in the rural. Sometimes it's in the jungle, but the medical staff there, the team there, they go to the village, they go to the jungle to find out the patient, bring the patient to the hospital and get the treatment, good recovery, and give them back from the community. Because they want to treat for the patient and also want to change the community vision about the hydrocephalus and the other disease. So I think, wow, it's awesome. That's what I want to do. That is what a doctor need to do for the patient. It's a very long story, and I think it's good. So in Vietnam, I just focus most time in the hospital. It means we just stay there and wait for the patient come. Sometimes it's too late. So I think, we need to do something for the patient get the treatment earlier, or sometimes prevention.
Prevention,
yeah. Prevention.
So what can be done for prevention?
I think we can do many things for prevention, and we need a lot of people to do that. But for me, I try to do a lot of video, or a post on Facebook, to see to tell everybody, oh, this is hydrocephalus, or lacking of some nutrition or some disease can cause hydrocephalus or the other disease.
I see. Yeah. So there's kind of a bit of a lack of awareness that needs to be addressed. And then it sounds like even some of the interventions can be quite simple, like maybe through, I guess, like vitamins and supplements or nutrition. Yeah.
You know, because I'm a pediatrician. I'm a pediatric neurosurgeon. You know, some neurosurgeons, they think, oh, I can do very perfect surgery, like microsurgery for very big brain tumor or very special disease. I will stay in the operating room maybe 8 hours or 12 hours and finish our surgery perfectly. And they don't care about doing something for the community, like prevention, you know. But for me, sometimes we spend 8 hours, but we can have maybe 1,000 or 2,000 or sometimes million people in the community. But if you spend 8 hours for one patient, you only have one patient, you know. So sometimes I think we need a specialist, a surgeon to do surgery, but also we need the other people to do the other thing, like to sharing about the healthcare knowledge to the community.
Yeah, I mean, really, it's using tech to share that knowledge at scale, as opposed to just one-on-one as clinicians are used to doing.
So I think in developed countries, they had a team, you know. We are doctor and we have another team to do that. But in Vietnam, right now, we don't have. So it means the doctor need, but the patient need it. So when we are a doctor, for me, I decide to do what the patient need. And after surgery, I do the other thing for the patient.
That's amazing. But I imagine that it's a lot, right? So what is life typically like for a doctor who is working in a public hospital? Like, what are your hours like? Are you on call all the time? And how do you make time for these education and awareness events?
I think everybody has 24 hours per day. And if we really want to do, we will have time to do that. So I don't have very fit schedule, you know. I just plan to do, and I will set up what is my priority and what is next, and I can do it maybe for almost 10 years, and you know, it's still going on.
Yeah, I see. And is that the situation of most other surgeons in Vietnam too? Do they have control of their schedules, or are they kind of busy with certain hours?
So I think the surgical in Vietnam now is very good quality. I think it's the same quality maybe in Thailand, Singapore, or US in some technique. Even we don't have enough instrument, equipment, you know. But for me, it's still not enough for the patient. But because some disease don't need to do surgery if the patient has the information earlier, you know, because they can prevention, or sometimes some tumor we don't need to do surgery first. We can take the medication, or sometimes we can do chemotherapy, and the tumor from bigger can smaller, and after that you can do surgery very easy, you know.
Yeah. And what are the top things that you wish that patients were more aware of in terms of preventing hydrocephalus or some of these other conditions?
So after maybe almost 3 years do FANPay for hydrocephalus patient in Vietnam, right now I'm happy because most of patients in Vietnam, they know about the hydrocephalus and they know where they can get the treatment in over the Vietnam. I'm not sharing about the Ho Chi Minh City. I try to give them so many places that they can get the treatment from the north. In Hanoi, in Hanoi, in Huế, in Da Nang, in Ho Chi Minh City, in Cần Thơ, you know. I want the patient, they have many options. It's very easy to get access to get the treatment. And the other thing is following up. I also do a fan page to following up the patient, but sometimes they think, oh, we are we get the treatment already and we don't need to do anything, you know.
Oh, really?
Yeah. So I remember in developed country, they have medical staff to ask the patient, oh, this is time for checkup with your neurosurgeon, right? 1 month, 2 months, 3 months, or 1 year later. But in Vietnam, we don't have staff to do that. But I had the pamphlet, I had an online group to remind the patient, but sometimes they do not cooperate with us, you know. And sometimes the patient coming back with very terrible. Yeah.
Oh, I see. So kind of like the treatment adherence, follow-ups, that's something that's being a bit underserved, maybe because of lack of awareness as well.
Yeah. And sometimes they think they don't have enough money to travel, you know.
Right. Yeah. Do you think that there's any sort of like solution to help them if they're living in a community outside of the cities?
Yeah. So I think some patients live in very far and very difficult for them to go to the city center. You know, most of specialists, they check work in the city center, in the big city. And we in Vietnam, we have very big problem, that is the distribution. Because like in Ho Chi Minh City, we have so many specialists, but the other, we don't have. But the patient, they will travel from outside to Ho Chi Minh City or to Hanoi to get the treatment. But with the patient, they don't have enough money. What can they do? They just stay there, you know? So I think at this time we can do that by telemedicine. The specialists, they can stay, they can work in the big city, but they can connect to everywhere, even in the world, you know, by technology.
Yeah, I mean, huge potential of telemedicine to reach, low-income populations.
Yeah.
It's not always about having the latest, you know, kind of expensive machines, but working with what we've got.
I think it's real. It's not potential anymore, but it's real. Right now, Zalo, they have around 75 million users. That is real user, you know.
Incredible,
Yes.
yeah.
I think most of Vietnamese citizens, they are using Zalo. So I think it's a very good channel for medical staff to connect with the patient. And together with Facebook, with YouTube, and the other website or application like Docosan.
Wonderful. And so, like, what else is exciting in terms of technology, for you that's going on in Vietnam now?
I spent time to work together with the technologies in 2019 after coming back from US, and right now it's almost 4 years. Everything is going really well, very quick, very quick. At the first time, I won only maybe 1 or 2 company, but right now we have so many. And finally, I think the patient will have a lot of benefit because they have many options to connect with the medical staff.
Definitely. So do you think that telemedicine is the most potential, or what other type of tech are you excited about?
Telemedicine. So for me, when I become a doctor, I told you before, I choose the patient. I will do everything the patient needs, and I will be where the patient is, you know. Right now, the patient is online. Online. Sometimes I just said, oh, the patient on the cloud, and we need to be there, you know. So right now the first thing for helping the patient is need to be legal. I will do everything legal first, and right now telemedicine is legal in Vietnam. And the second one is very good knowledge. So I need to gain my knowledge time by time, day by day, update, you know, to be a member of international society, or get more training, you know, more practicing to improve my knowledge, my skill. And the third one, in maximum, the other for sporting, like sporting material, like instrument, like people, the teamwork, like technology, you know. So At this time, I spend a lot of time to study about the technology like the app, Zalo, OA, ChatGPT. Yes, yeah.
What do you think about ChatGPT in healthcare?
I think it's really good. For me, I have to work many jobs at the same time. And I really need assistant, but I don't have. Because I'm a very small doctor, and I don't have enough money and to get assistant. But ChatGPT is a super assistant for me, so it helped me a lot.
Yeah, amazing. It's interesting hearing a surgeon because you think, okay, he must be, in a surgical gown and, a surgical amphitheater doing stuff. But having a chatbot is something that's useful for you. So how does this assistant help you?
I just started using ChatGPT maybe 3 weeks ago, and it's impressing me too much. After 1 week working with ChatGPT, I introduced for everybody in my hospital and also in the Youth Federation in Ho Chi Minh City. So everybody is very interested about the ChatGPT. I use it to create the content for social media platform. I use it for understanding about the culture, like Taiwan. I can ask many things about Taiwan. Even ChatGPT can compare the weather in Ho Chi Minh City, in Taiwan, and Singapore by month. And it can help me to design any idea about the logo from, or sometimes business. It's also helped me to study English or traditional Chinese. It's very easy because I can do it at every time, anytime and everywhere.
Yeah, no, I mean, that's so interesting. So not only is it kind of like helping you, I guess, like not so much in clinical practice, but helping you get messaging out and communicating with like patients in a more efficient manner because you're a surgeon, you don't have a lot of time.
Right now I'm working with many many professors outside Vietnam, so I need to do email for them. Sometimes it takes time because I'm Vietnamese. And when I try to write in an email for them, it takes time. Sometimes 30 minutes or a few hours. But right now with ChatGPT, I just said, I want to say with my professor, the ABC, and please write an email for him with very respectful, very appreciation. So maybe in 2 seconds, I have an email.
Oh, wow.
Yes.
So it's breaking down kind of those, language or even kind of cultural barriers because you can send something very quickly, very clearly.
So I think it helped me so much for me. I don't know how about the other people, but I believe ChatGPT and the other application will roll a very important place in our world.
Yeah, I totally agree with you, Dr. Me.
Yeah.
Well, that kind of wraps up my questions now. So thank you so much for this interesting and inspiring conversation. And so our listeners can find Dr. Me on Facebook at his fan page, Big Head Baby, and on Docosan. The links will be in the description. So thanks for listening and catch you later on Demystifying Healthcare in Vietnam.
Thank you, Beth. Thank you, Docosan team, and thank you everyone for watching. I hope together we can do something better for the patient in Vietnam and in the community.